Praveen?
Yeah, sir, good to go. You can start.
Are we good to go?
Yep, yeah.
Morning, Deepesh. Praveen, is Deepesh
morning.
online?
Yes, he's all set.
Good morning.
He's all set. Good
Yes,
morning,
yeah.
Deepesh. Praveen,
Good morning.
good morning, Deepesh. Have we got people in?
Yes, we have 25 people already in and still coming. But meanwhile, you
Okay.
can start, sir.
I think we can go ahead, isn't it?
Yes.
Okay. So Deepesh will kickstart the program.
Yes, sir.
Yeah. Good morning, everyone. Dear colleagues, on behalf of the Karavali State Chapter of Maxillofacial Surgery, at the outset, before we start this webinar, I would love to wish each one of you out there a happy Maxillofacial Surgery Day. I only hope and pray to God that we dedicate ourselves to serving mankind or human race to the best of our ability. God bless us all in this endeavor. And on behalf of the Karavali State Chapter of Maxillofacial Surgery, India, we are proud to present and kickstart our series of webinars with the first speaker being Dr. Deepesh Rao, who's going to address us on future avenues following masters in dental surgery, maxillofacial surgery. Dr. Deepesh, who's a good friend of mine, is a dually qualified oral and maxillofacial surgeon with degrees in medicine and dentistry. His hunger for knowledge led him to do numerous fellowships in cleft lip and palate at the Bhagwan Mahavir Jain Center in Bangalore, fellowship in pediatric oral and maxillofacial surgery from Royal Children's Hospital, Melbourne, fellowship in craniofacial surgery from the Oxford Craniofacial Unit, United Kingdom, fellowship in AOCMF from Hanover, Germany. Presently, Deepesh is a consultant craniofacial surgeon at the Bhagwan Mahavir Jain Hospital, Bangalore. With these few words, I invite Deepesh to enlighten us on the future avenues following masters in dental surgery. Over to you, Deepesh.
Thank you, sir, for being so kind and giving such good introduction. Again, happy Oral and Maxillofacial Surgeons Day. I think this day was long due, and now that it is being celebrated internationally, it is something that gives us a lot of pride. Just a moment, I'll just start sharing my screen. So I thank the organizers from the Karavali chapter of AOMSI, and also, hello, am I audible?
Yes, Deepesh, you are.
Yes, sir. Yeah. So I thank the organizers and also all the participants. I have not, when this question is asked, what next after MDS? I think it's a very relevant question, because if we ask this question, we will try to seek answers. And when we try to seek answers, we will get to where we want to. So I have tried to, with whatever little experience I have over the years, try to formulate a pathway, or the multiple options available for postgraduates. So it's mainly for the postgraduates. However, I always believe that learning is continuous, and we can always get better from where we are today. And I probably hope to have the same hunger when I retire, probably in 30 years' time. So, when I was a first year PG in 2007, I attended the International Conference of Oral Maxillofacial Surgery in Bangalore, and my mentor, one of my key mentors, Dr. Kishore Nayak, had this wonderful talk, which also, of course, Daniel Laskin has also published it in his paper in 2008. But in this talk, Kishore Nayak highlighted the scope of oral and maxillofacial surgery. So he basically said that there is an area of expertise, an area of competence, an area of familiarity. This was way back in 2007. We are now 13 years from there. And I feel we are in a stage where the area of familiarity has started to become an area of expertise, because a lot of us are now cleft lip and palate surgeons. We do a lot of oncosurgery, microvascular surgery, including the new crop of surgeons who are, or of course the old surgeons as well, who have now diversified into facial aesthetic surgery. So what is the denominator in all of this? So basically, the area of expertise is what you probably get out of your post-graduation program, even if you don't get hands-on. So because I am trying to get this message to the current crop of PGs as well, or the ones who are in the training process, who probably might have a lot of frustration because some of them might not be getting inadequate hands-on. But the situation is no different anywhere. But when you get the opportunity, you have to start doing them as if you've been doing them for many, many years. So how do you do that? I think basically by being aware. So when you look at your bosses or your seniors, whenever they're performing the surgeries, make a mental note of it instead of just standing there with the suction and the retractor. You can make a mental note of the steps that are involved and keep going through the steps again and again. So when it comes to you, you start doing it as if you were doing it all along. So that area of expertise that happens in your MDS, and immediately after, so 1 or 2 years, becomes fortified. So that becomes your main core specialty or your area of expertise as a maxillofacial surgeon. You can then become competent if you add that. So that is MDS plus 1 or 2 years, and then add another couple of years and increase your scope of competency. If you add that to a new domain of specialty, and this has been something that we have been doing for many years now, and in a country where cleft lip and palate surgery was dominated by plastic surgeons. At this current time, I think we have more maxillofacial surgeons performing cleft lip and palate surgery than plastic surgery, which is a great thing. So, which means we are able to now challenge and make our area of familiarity our area of expertise. So, investment of time is the only thing that will account for what your core ability would be. And this is very important to know, because when we think about what the future holds for us, well, what is the time scale that we're looking at? How much time can we dedicate for getting to where we are? Sometimes a lifetime, sometimes a few years. But is it going to cost us money? Whether are we going to be able to earn the money that we want? What is the balance that I need? How am I going to dedicate time? How am I going to dedicate this factor that, at some point of time, I'm not going to earn that money that I aspire to earn. I might have loans, I might have a family to feed. And everybody, trust me, everybody, irrespective of what financial status they have or they come from, they have this problem to deal with time and money. These two parameters are something that if you try and calculate and make an assessment of how much you are able to do, you will be able to chart out your roadmap for the next. So there is a book called Outliers. I think every young PG should try and read this book called Outliers. It gives a very simple formula to success. And the formula is 10,000 hours. If you give 10,000 hours to master your craft, that is 18 hours a day, 5 days a week, 44 weeks a year, and for 5.5 years, you will become the master. So imagine that's a lot of hours, that is a lot of days, that is a lot of weeks and dedication with years. So we better get started. So we better try to identify, yes, this is what I want to do. This is where I want to dedicate my 10,000 hours. And this will get me to where I want to be. So how do we get there? I love this quote. I might have used this in the past at least 3 or 4 times. And this is the quote which resonates with me. And I think if we understand the deeper meaning of this quote, we will never, ever fail in life, because the greatest enemy of knowledge is not ignorance. It is the illusion of knowledge. So the moment you start believing that you know this stuff, you know it, you are the master, you are limiting yourself from becoming who you can be. And that is where great minds have become greater, because they accept the fact that yes, there is a lot more for me to achieve. There is a lot more for me to understand. And that is where the future, when you think about, okay, what is going to happen next? If you think that I know this already, you're making a mistake. It might be as basic as taking a wisdom tooth out, and that is where the finesse of surgery is important. That is where, surgery is such an amazing, rewarding specialty, where every day you learn something. Every day you understand that the tissue handling will reduce the edema, tissue handling will make the procedure more. And it is as simple as wisdom tooth extraction as an oral maxillofacial surgery. That is something that we should all be able to do. And if we can try and challenge ourselves in making it much better, much simpler, the future is amazing. And this is another quote which Rahul Dravid said when people were asking him, what makes you so special? He said, I believe in the story of the bamboo shoot. A lot of people think that the bamboo shoot grows in 6 months' time, because you get a sapling and you put it and it grows tall in 6 months' time. What they don't realize is it takes 5.5 years for that sapling to make its root enough for it to stay supported. So that 5.5 years is what makes, is what is the 10,000 hour rule, actually speaking. So it is basically putting your foundation correct. Then you can shoot up and become a bamboo shoot and bamboo tree. The other important quote, which I think is important, is run your own race. Who cares what others are doing? Because, each one is going to tailor their future based on what they want to do. You can become a minor oral surgeon, a perfect minor oral surgeon. You can become a cleft surgeon, an orthodontic surgeon, a TMJ specialist, a cancer specialist. There are many avenues. You can be an all-rounder, but do not look at the other person, because that is just going to limit what you can do, because that is not how races are won. The race is with your own self. The question is, am I progressing? Am I getting better from yesterday? Because the key for tomorrow is dismissing the knowledge of yesterday, but fortifying it within. So basically, you challenge it. You challenge yourself. You make your own norms. You get yourself better, and that's how it becomes exciting. That's why every morning when I get up, I'm excited, because today I'm going to do a surgery. It might be the same surgery. I'm going to do the same palate surgery, but I might do it better. And there is always room for improvement. In all this, one key thing that is required is a mentor. I have been very fortunate. I have a long list of mentors from my BDS days to my PG to my fellowship and all the other fellowships. I have a long list of mentors, and I can't be more. I can't bow before them enough, because I am today what I am. And I'm not anywhere close to what I want to be, but because of my mentors. And one name I always take is Dr. Krishnamurthy Bonantaya, who's been my whole and soul, because he gave me direction when I thought I was wavering. And he also gave me the belief that I will become something. But of course, the others like Preetam Shetty, Kishore Nayak, Sanjeev Nair, K. Gopal Krishna. There are so many in this long journey who have been instrumental. And I think this is where we all need to find a mentor. It can be your PG guide, someone who's in private practice but ready to take you in. And there is always there is so much wisdom from that experience that they've had in the last 25, 30 years, or 15, 20 years, whatever. There is enough wisdom to learn just by standing or talking, even on over a cup of coffee or a couple of drinks. There is so much that you can learn from your mentor that you will not be able to learn if you are out there on your own. And that is where you need to have a mentor who wants you to grow, someone who sees the passion in you, and where you can share your dreams with him, and he will let you grow. So this is a process, because it is not important to win, it is to become successful. It is not even, it's not even important sometimes to be what people identify as success. But what is important is planning and preparation. They are very, very crucial. And Eliud Kipchoge is a perfect example. He planned his run to become under 2 hours a marathon runner. the best day to run, the wind is helping him, the best pacers to help him make that run. So it is not just an individual effort. It is never an individual effort. He can take the credit, but it is everyone else out there, the planning that goes, the preparation that goes, that makes it unique. And that is where I'm now going to come to. So plan your future. Make sure that you want to know whether you want to do clinical stuff, whether you want to do non-clinical stuff. There is no harm in doing non-clinical stuff because, like I said, everybody's dreams and aspirations are different. It need not be the same aspiration. You do not want to see a surgeon and see a surgeon do surgery, but if that's not triggering a fire within you, you don't have to do that. Yes, you might have become an oral maxillofacial surgery PG, but at that point, you were not sure what you wanted to do. So that's all right. There are these avenues that you need to explore. So let's get to the non-clinical fact first. So in non-clinical, as if you have now done BDS and MDS, you're forced to do something after MDS. No, you can diversify. That diversifying, it's only in India where we think that we need to be stuck to what we have gained for now. You take it, why America is so successful is because they are not rooted by concepts. They are rooted by freedom. That freedom is important. That freedom is me, myself, not what others will say, what others will tell me to do, and what my parents want me to do. So if you have now done your master's in oral maxillofacial surgery, and for some reason you do not like the specialty, or you do not see yourself continuing that, diversify. Find your passion. It might be in research, in MBA. You can even take up, craniomaxillofacial implants. You can join a company, help develop an implant. There is a lot more happening there in that world. Or you can become in the CMF, craniomaxillofacial technology. So there is navigation surgery. There is, the image guiding procedures. There is Da Vinci now. There is robotics. There is a lot of avenue where your skill as a doctor might help you become something else, which might not be a maxillofacial surgeon, but clinically relevant to another maxillofacial surgeon and to offer the patients for the benefit of everybody. So this is where you need to find your passion. There are so many avenues. And of course, I might not be the right person to highlight research, MBA, what are the avenues, but I think the internet is there for us to see. I'm just trying to highlight the different possibilities, and possibilities are limitless. If you want to do clinical practice, right? Most people can go straight into private practice, but then you have to know that, are you being true to yourself? Is this what you want to do? Yes. If yes, then of course you should build your private practice and then manage your private practice as if this is what you want to do. So you can do a good private practice. You can do dentistry because you are a BDS. You can do maxillofacial, which limits to the dental practice. So you can be a referral center for medically compromised patients. You can do oral surgical procedures. You can do minor oral surgery procedures, some small cysts, all this in your private practice, and you can build up your private practice. At the same time, if you want, you can go for additional surgical exposure. So if you don't want to do private practice, you can either go for an additional surgical exposure, which means you might have to sacrifice either the finances or the time for the loved ones, and go out to be in an academic post. So these are the three possibilities immediately after PG. So you can do private practice, you can do additional surgical exposure, or you can join an academic post. Now the academic post will be in a college where there is some some work happening, where there is maxillofacial work happening, or in a college. Unfortunately, not all colleges are same, so there is no level playing field. There are some colleges where there is enough maxillofacial work happening. There are some colleges where there's not enough work happening. So in those colleges, you can do an academic post which involves a lot of research. But I think sometimes the combination of the three might be a very good common ground. So you try to get some private practice positions, simultaneously try to see if you can get some additional surgical exposure. Yes, some academic posts are full-time, and it might compromise your private practice or the additional surgical exposure. But if you find that balance where you can balance all of it, you might have the best clinical ability. However, remember, we go back to the same 10,000 hours. All of this will not happen instantaneously. You will not become a maxillofacial surgeon who's operating all the time effortlessly, giving more scientific and state-of-the-art treatment if you have not spent that 10,000 hours in the specialty, if you've not understood the specialty, the core of it. So that is where it is important. So additional exposure can happen in a stage-wise manner. So now I have highlighted in the same area of expertise, competence, familiarity, I've highlighted maxillofacial trauma, because trauma, they say, is the bread and butter of maxillofacial surgeons. We should be able to fix a mandible, we should be able to fix the maxilla, we should be able to fix other complex maxillofacial injuries, if not. So we should also be able to do some soft tissue procedures, so lacerations and all of that. So how do you do that? How do we go about that? If you want to do maxillofacial surgery, trauma specifically, the best centers sometimes are the rural and satellite centers where there is not enough care providers. And if you are the care provider, you will be able to be there in places where there is high trauma because of the way the road safeties are poor, people are in two-wheelers, the awareness is low, they don't know where to go, and they would probably come to you. So you might get small lacerations, you might get some isolated injuries. Of course, there might be some occupational injuries like a bullock carting fall, or a kick from a cow when they were milking the cow. So all these things happen in a rural area, and they don't have enough care providers. And if you spend some time there, you might be able to get exposure in maxillofacial trauma. Yes, you will probably learn by trial and error, but if you don't have a mentor who you can spend time with, and if you have your concepts right, if you have your basics right, if you have done a course in a trauma, say a SOR course or an AO course, I'm taking the name of two major courses. Of course, there are so many other courses. Then you can probably apply that, background knowledge on your clinic, in your clinical practice. There are AOMSI fellowships now, which is amazing, which is a brilliant start for any young, newly completed PG to just go ahead and do an AOMSI fellowship, where you can learn from the masters themselves how to do that, and not only just get surgical skills, but also probably improve your clinical acumen. The other places are teaching institute with a high volume trauma, or in government institutions, especially, again, like I said, this government institution might be in relation to the rural setups where there are some government hospitals, but not enough people. So this is where you understand that not everything is going to happen quickly, but if I try to channelize and make myself, available in these areas of possibilities, then you can learn what you want to learn. Of course, I've listed the fellowship centers for trauma. This is all available on the AOMSI website, which is it's phenomenal that we now have 9 centers for trauma. And now that we have spoken about the area of expertise, if you have to build the area of competence, like I said, it is an incremental process. It is not going to happen overnight. You will not finish your PG and start doing an orthodontic. If you will, you might end up in trouble early than not. So I think having complications is not wrong. I mean, everybody has complications. Everybody says that. In fact, recently somebody was discussing in one of our WhatsApp groups, they were discussing complications, and I think the bottom line with complications is, if you have done enough, you will have complications. But the caveat to that is, if you have not done enough, also you will have complications. And that is where the problem is. So you have to think about this, that you don't want to start whatever you want to do, whether you want to do orthodontic procedures, TMJs, or regional or local reconstruction. This is the area of competence, like I said. And if you start off with that, and 1 or 2 cases will go well. Trust me, the first one goes well almost always. And after that, when you find a complication, it will dissuade you from doing any further. And that is where you have taken a step back instead of going forward. So you have not built up your level of competency in this subjects where you are trying to venture. So it has to be an incremental process. You have to build the blocks with strong basics. Try to seek a good mentor, see them, and find out how they will support you, how you can learn from them. There are so many mentors now who are more than willing to come and help you in a case when you start off, something of that kind. And of course, there are 3 more fellowships for your competence as well. Now, the AOMSI fellowship on the website, you will find a list of places where you can go spend some time. Most of them will be in Germany, some in the UK, then there is in China and the US. Try to find the fellowships of the AO fellowships where you are allowed to scrub in. When you scrub in, you, like I said, you might not be doing it. Of course, if you are smart enough, you will make a mental note of exactly how they do it, how they hold a knife, how they hold the retractor, how they cut, what is it, write it down, make a mental note, repeat it to your shadow practice. You keep shadow practicing. So when you get that knife and when you make the cut, if not same, if not similar to how they did it, close to how they did it. So that is how you learn in these fellowships. The IOMS has also started with short-term fellowships, which again is funded by the IOMS Foundation, where you can go in and visit for 3 to 4 weeks to a high-volume center. And of course, the AOMSI fellowships are also crucial in improving the competency level of the current people. So this is the AOMS fellowship, where you can do it for 4 to 8 weeks. And like they said on their website, they say that they support 60 to 65 fellowships yearly, which is phenomenal. Imagine the number of people. And of course, I think a lot of people from India have gained from these AOMSI fellowships. You have to choose your centers wisely. Now, once you choose your center, you can discuss it with your mentors and see if you think that these centers are worth going and spending time with. It not only helps you learn from the mentors in the center, but it also helps you get some global exposure to standards of care, how they communicate, what are the soft skills that you need to pick up. There is a lot of growth that happens via these fellowships. And like I said, the IOMS fellowships is funded by these IOMS Foundation and the Osteoscience Foundation. For orthognathic, we have on the AOMSI website, there are 5 fellowships. I think these fellowship numbers are going to keep changing, or they have already changed. I might not be aware completely. But yes, you have orthognathic surgery centers where you can train in India, and most of these mentors I think are phenomenal, where there is no doubt that you will learn a lot more when you want to diversify in future. So when it comes to expertise, when it comes to the area of expertise, like you said, cleft lip and palate surgery, oncosurgery, and international fellowships in clefts or microvascular surgery. This is where it is important to, before you venture into cleft lip and palate surgery or oncosurgery, you have to build up your core. You have to have some understanding of your competency, some understanding of your area of core basics, and then you diversify. Then you go into areas which will require further commitment. So the fellowship centers for oral oncology, again, there are a few centers on the AOMSI website. I've put them up. You can take a screenshot, or you can, of course, go and visit the AOMSI center. I've been a part of Bhagwan Mahavir's hospital from 2010, and I can't, talk more highly, because they have been the pioneers in working together. A lot of surgeons do that when they build a team, and Dr. Sanjeev Nair leads a wonderful oncology team, and there is a fellowship that has been going on from 2010. Of course, the Foundation of Head and Neck Oncology has multiple well-reputed oncology fellowships, and the list is also on the FHNO website. You should look it up, and these can be applied to, I think, a central exam where you can go and do your fellowship in oncology. With clefts, and of course, I have to say this at this point, that I might be missing out on a few centers because for my pure ignorance, because I can't keep pace with the number of fellowships that are coming up. However, some are right up there, some are well-renowned, the best. Some are growing, are still becoming better, are still blossoming. So you might have to choose wisely. If you've had an exposure in the past and you just need some more exposure, you can go with those new fellowship programs, which are still finding their feet. But if you are a fresh learner and you want to get from the basic up, you might want to go to fellowships which are more reputed. So you will have to do some background work. Like I said, nobody can tell you what to do. You have to find your own path, and that is where it is very crucial. Coming back to the cleft fellowships, I'm a prodigy of Bhagwan Mahavir Jain as a cleft fellow when I completed in 2010, and I have now come back and joined the same hospital. So yes, I think the fellowship here, of course, I'm biased, is probably one of the best in the country. But of course, the other the good ones are without doubt the GSR fellowship, the fellowship in Chennai SRM, and the Operation Smile fellowships and the CCI fellowships under Dr. Manikandan, Vikram Shetty, and Parth Madani. So there are these fellowships. Like I said, again, I will reinforce, are not the most exhaustive list, but of course, these are things that I think we should all know. And there are other fellowship options like the Craniomaxillofacial Fellowship under Dr. Paul Silence. There's a Maxillofacial Trauma Fellowship in HOSMAT. There's a Facial Aesthetic Surgery Fellowship, which a lot of young maxillofacial surgeons from our country, a few of them I know have done by going to Nabil Fakri. And you can look him up. He is very nice. He's open to trainees writing to him, and I've met him a few times, and I think he's a very good mentor. So he will try and make sure that 1 month is the fellowship duration. If you go there for 1 month, he will try to expose you to at least most of what he does and how to deal with these facial aesthetic problems. The Nudolf Visiting Scholar Fellowship in Changong is one of the most reputed. So Taiwan Changong Hospital is the most reputed hospital for both microvascular and clefts. Again, they have a paid fellowship and a visiting fellowship. So some fellowships where you can go and spend a year, up to a year, but they will not pay you, but give you an accommodation. So those are also an option. But if you want a paid fellowship, then you have to apply for a scholarship. There's more competitive, but it is not impossible. So you can get them as well. So all that I have discussed in these slides are fellowships that are available for everybody, right? Not for dually qualified alone. It is for everybody who's doing MDS maxillofacial surgery. Okay. If you want to go abroad, right? And if you think about Australia, for instance, I will only highlight the 3 countries where I have been to. There are again, I will say that there is a lot of possibilities. Every option that you can think of is possible. So I know one person called Ranjit Kunchur. He is, I don't know whether he knows that I'm taking his name now, but I will give his example to you for you to know what the possibility is. Okay, so he, I think, completed his PG in 2001 or 2. Then he worked there. No, so sorry, 2002. Then he worked in India for a couple of years. Then I think went and joined Dr. Kiran Gadre and was a part of his team. He also joined some colleges to become a junior staff. He always had this passion to do something more constructive. So he then left and went to Australia. So he did his Australian Dental Council exams, went as an oral surgeon to Australia with the idea of doing the maxillofacial surgery program there. So he then joined medicine, where he was working as a part-time oral surgeon after his Australian Dental Council exam. On a weekend, he would do work as remove wisdom teeth, and for the week he would do his MBBS program. After he finished his MBBS, he joined maxillofacial surgery, and he did not like the way they were treating him because he was already old. And in 6 months, he chucked the maxillofacial surgery program and he joined the plastic surgery program. So this is what it is. So this is what I'm saying. Avenues are limitless. You have to just explore them. And he then completed his plastic surgery in 2019. He now is the craniofacial fellow in Brisbane. So yeah, his journey is exciting. Again, you can consider going to the US. You can either go to join a residency directly, which is not almost always possible. In fact, just for this talk, I so happened to speak to Harshit Vyas whose name is mentioned here, who is one of an A.B. Shetty prodigy. So he passed out from A.B. Shetty, I think, in 2011. And after a couple of years, he went to the US straight to do his residency program in Tufts. So, it is possible. He got in there. Of course, it might not be easy for everyone to do that. But he went there, joined the residency program, and finished the program from Tufts, joined a fellowship in pediatric oral maxillofacial surgery, and now he's in Chicago doing his private practice. I write these names because if anybody wants to get in touch with them, I think we should be more than open to help them, to get to where they are now. Having said that, he did mention that it might not be always possible to join residency. So the best way to do is DBS first, and then do residency program. So that is what Aarti Rao did. So Aarti Rao is my batchmate from 2010, passed out from the SDM Dharwad. I think after a couple of years, Manjunath Rai sir might know her very well. She completed her maxillofacial surgery, stayed back for a couple of years. Then she went to the US, joined her DBS, completed her DBS, joined her residency. Now she completed residency. And stories like them are proof that if you want to do something, there is no time scale. You have to make some sacrifices. You have to give it all. Of course, we all know, in UK, there are so many of our consultants from the UK, and it is just a matter of time. And the pathways in the UK are just mind-boggling. You can just go there, be an oral surgeon. You can do the full spectrum oral maxillofacial surgery. There is, in fact, one of the other a dental student who passed out from Dharwad, whose name is Devang Deshpande, who got in touch with me, and he said that he's gone to do medicine in the UK after dentistry. So there are so many ways of getting to the UK. You have to explore the options. Of course, the UK training program is the most exhaustive one. That you have to be duly qualified if you want to be an OMFS specialist, and you have to do a core surgical training job. You have to do an OMFS registrar job that is just close to 5 years. So only after that you can become a consultant. So it's one of the long drawn processes. Of course, in the end, I have not seen any consultant complain that they are not doing well in life. So it is what you choose to do. Now, the reason why I'm throwing medicine in it, because a lot of people will ask me this a lot of times, and I get a few Facebook messages every now and then. There are two ways of doing medicine in India: NEET and taking management, because of the age limit. Writing NEET becomes challenging because there is an age limit to writing NEET. Of course, if you want it, many years ago, Krishnamurthy sir challenged the system and said that there should not be an age limit, and they took that rule off, and he wrote the entrance exam, and got a seat. I did not have the patience to do that, and I had to buy a seat on a management seat. That was my painful admission. But having said that, you can still get your medicine by NEET. If you want to go abroad, right, there are countries in the EU which you can join there. For instance, I know a friend who's very close to me now, and he passed out his PG in 2011. He's in Latvia, and he's the final year medicine student. It's a 6-year program. It took him time to go there, so he finished his fellowship in oncology in Malabar Cancer Institute. Then he went to Assam and worked with Ravi Kannan sir, who's now getting the Padma Shri. And he then wanted to go to the UK. He wrote the exam in the UK, but the fees was £30,000 per year, which was very expensive. So he found another place in Latvia, which was, I think, less in terms of, I think, 6,000 euros or odd per year. But he could manage that. Having said that, he was working in McDonald's, trying to survive himself. So these are examples which I think are very important, because what lies ahead of us? Limitless possibilities. We just have to choose something and go and this that. So I like this slide a lot, which is say how to be a marathon runner. First, you train for a marathon. You can't just go and run the marathon, because it is not possible. You can never do that. You train for the marathon, you persevere. So you continuously go ahead, do that, train, retrain. Then you run the marathon. Once you finish the marathon, you say, oh, was this it? This was 21 kilometers completed. But did I give the best? No. And now you start working on your personal best. Now you start running it again and again and again and again, and you try to get your personal best. That's why probably, when they say runners are so happy because they're just trying to challenge themselves. So possibilities are endless. Every road, every turn is about a limitless possibility. You have to choose wisely. You have to choose what suits you the best. The future of OMFS as such is also diversifying. We are now going to virtual surgical planning, guided surgery. There is navigation surgery. There's artificial intelligence and robotics and genetic engineering. So there is so much more beyond just the surgical spectrum that you can now go and try to approach and try and explore. The solution is identify what is your goal. Divide your goal into 5-year plans. Pocket it. So you now can act on the first 2-3 years of each pocket. Give your best to it and have the patience for it. It will work for you. Say that there are effective habits. You follow your heart, do what you love, think creatively, have the courage to fail, never stop learning till the end, and stay true to yourself. You will get to where you want to become, because most of the self-help books, I love self-help books because they keep reinforcing what I want to know. So this is one of the books that I'm now doing, audio listening, 7 Habits of Highly Effective People. And it is just the same. Be proactive, begin with the end in mind, put first things first, think win-win, seek first to understand, then to be understood, synergize, sharpen the saw. So these are things that are out there. We just need to apply, and we need to keep climbing. Thank you so much. I really appreciate your time and patience. Thank you.
Hello. Okay. Thank you, Dr. Dipesh. Yeah, it was really wonderful talk, and so nice of you. We were all very happy when you finished your training and came back to Bangalore, your alma mater, and now you are helping to grow the department. And when we thought about this particular program, and then when we decided that somebody should speak, we didn't had any second thoughts about who should be the speaker. So I once again congratulations to Dipesh. You finished your training and came back, and now you want to see you grow and keep motivating a lot of youngsters in this field. Thank you so much, Dipesh. And I'm very happy to see some of our seniors in this group. I can see Dr. Karyappa. Acknowledge the presence of SM Sharma, Bhagwan Das Rai, Dr. Nandi Shetty, Sonal, and so many of us. So many people are watching this debate. And in our department, we are watching around 15 of us watching in a seminar room. That's the reason many departments are doing it in a single screen. So that's why a number of people. So whatever you are mentioning,
the extent of the lesion.
Yeah. Now, before we close, there are some videos done by some of the individual departments, like KMC Mangalore, Manipal,
30 Vaikral, 20 Vaikral,
and AV Shetty and KV General College. So we'll just play the video. Mr. Praveen, kindly take over.
Gloves. Just ask Vasu if he's done with his rounds to come here.
Dr. Abhay, can you just mute yourself, Abhay?
Gloves.
Greetings from KVG Dental College, Surya. Happy MaxFac Day. Proud to be maxillofacial surgeon.
Happy MaxFac Day.
Wish you all a happy maxillofacial surgeons day.
Wish you all a very happy oral and maxillofacial day.
Hi, wish you all a very happy International Oral and Maxillofacial Surgeons Day.
Happy International
Happy Oral and Maxillofacial Surgeons Day.
Hello. Hello.
Hello, sir. Hello, sir.
Yeah. Okay. Yeah, that's a small sneak peek from two of the departments of Mangalore. And I would like to take this opportunity to invite you all for the 45th annual conference of AOMSI to be held in Mangalore from 2nd, 3rd, 4th of December. So hope to see you all. And I once again thank Deepesh for your wonderful presentation. Like to thank A1 Logics, Praveen, and all the participants. Thank you all and wish you all happy OMFS Day.
Is it?